The first grant I wrote to DTAF was for an Anderson School project, and it's got primarily a population of American Indian children who have extraordinarily sick mouths. And so my thrust was to get the parents of the children interested in oral health care, and we expanded the project to include not only the children who were in the school, but their younger preschool-aged siblings, and also their older siblings who were going to other schools. So the whole family, including the parents, could come into the dental clinic at Anderson School and get care. Now, some of the outcomes, mothers did a better job of making sure that their children weren't put to bed with a bottle that contained anything but water. They were doing more toothbrushing, starting earlier on in life and doing it twice a day with fluoridated toothpaste. They were making sure their kids were drinking the public water, which has fluoride in it. Now, the latest venture or adventure, as the case may be, I have got funding to create oral health zones. And basically, an oral health zone is a county or a community wherein the stakeholders in the community take ownership of the caries problem affecting their children. One, we're going to try to increase the oral health literacy across the community. Secondly, making sure that all the docs in the community, nurse practitioners, are trained on this caries prevention intervention of educating caregivers about caries etiology and their role in prevention and putting varnish on the teeth. And thirdly, under the watchful gaze of the stakeholders, the medical and the dental providers are going to be responsive to the pleas or demands of the stakeholder groups that, folks, you are the only two people around who can take care of our kids' teeth. So the docs can say, well, I'll do the prevention, I'll educate, and I'll put varnish on if you, the dentist, will take any and all referrals of mine, irrespective of their insurance status. Well, DTA has helped me by allowing me to get started on a project which has led me to other funders for funds. And so what started as an $8,000 contribution and then a little later on a $5,000 contribution from DTAF, over the last decade, I've generated a little over $480,000 worth of grant support from various organizations to continue the WIC project, the Oral Health Zone project, training the physicians in Minnesota how to do caries prevention.